I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More Here.
Welcome to IDD Health Matters. Our guest today is Michael Siegelman. Welcome, Michael.
Thank you.
Tell me about the work that you do in this field.
So I am a nurse educator. I provide trainings to our RNs who are employed by the providers who receive money from our state.
That's an important and big job. Yeah. So what are some of the types of trainings that you provide?
I believe it's 6. I'll have to count while I'm saying it, but there's new nurse orientation. There is training to make our healthcare management plan, basically a nursing care plan, person-centered. So it's titled Developing a Person-Centered HCMP. A psychotropic medication review form. It's accurate completion because we had a number of people that weren't finishing that fully, all 3 pages. So we have to do a complete guide on how to finish all 3 pages. And then there's person-centered thinking training, which is nursing-focused, 2-day training. The RN train the trainer for TMEs, which is trained medication employees. I think that's it.
All right.
6.
What is a trained medication employee?
Sure. So they receive certification to administer medications to our people in our state who need medications administered to them, who cannot do it themselves.
Okay. So we think about nurses typically being people who administer medications, and that's not always ideal, right? You can't have a nurse with a person with a disability everywhere,
right,
whenever they might need medication. So there's a process, and in many states have this, and it's different, and they call them different things in different states. But it is an important part of this field, I think, because it allows people to be a little bit more independent, so that the person that is supporting them and providing that direct support can also help them take their own medications. So that's kind of what we're talking about here, right?
Right. And so that the person in their home or the person that makes daily visits or twice daily visits isn't always the nurse. It could be someone that they are even more familiar with, a direct support professional or the state's equivalent. And it just gives one more potential way for the person to feel more comfortable with someone being in their home.
So a lot of the training that you do sounds like ensuring certain processes happen the way they're supposed to, including documentation. There's a lot of documentation in this field, isn't there?
A lot.
Lots of paperwork.
Yes.
A lot. Yeah. So, and what we always said in medicine is if it's not documented, it didn't happen, which doesn't always mean that, but there's no record of it if you don't document it. So the documentation is a really important part of nursing. So speaking of training, in your school, the school that you did to become a nurse, did you receive much training about this field or about healthcare for people with intellectual and developmental disabilities?
None at all.
None at all. So how did you grow your knowledge base in this field?
So my first job was not nursing. It was not involved in nursing. My first job out of college was a teaching assistant at a school for children with learning disabilities. So it was a charter school. So I was there for a few years, and then I worked at a job training program in the same building. It was an art-based job training program. Then I got another job unrelated to everything that I did, and went to nursing school while at that job. After nursing school, I worked at hospitals, a few outpatient surgery centers, and then I just decided to go back into nursing, back into the IDD field and combining nursing with IDD.
So was that initial job kind of your introduction into this world, this field, or did you have an introduction to this field in some other way?
I was actually thinking about this a few days ago. In elementary school, I was paired up with, I think I was in 3rd or 4th grade, and I was paired up with another young boy who was in 3rd or 4th grade, but he was in a different class back then. And we would do lunch, we would do recess a few days a week. And that was my first time, befriending, hanging out with someone with an intellectual developmental disability.
Yeah. So that had some influence on what you decided to do in your career path.
It took a few years for me to get there after graduating from college, but yes.
Yeah. Yeah. So, that's something we hear sometimes is we think about what can, or what situations provide an opportunity for people to interact with people with intellectual and developmental disabilities to help, we talk about integration into the community, into society, and also to, one of the reasons we're doing this is to help people also understand that there are career opportunities in this field, and meeting people with intellectual and developmental disabilities and in our daily lives does have an impact in taking out some of that stigma as well too that we often see in this field. Yeah. So when we're talking about helping to ensure health equity, which we know that there are some inequities for people with intellectual and developmental disabilities, when we're talking about fostering health equity and equitable access to healthcare, what are some challenges that you might have experienced or seen?
Most of my stories now are hearing what the nurses are telling me, because I currently don't have, I don't work directly with the people that we serve. But my experiences years ago were people not feeling comfortable working with our population. So they weren't receiving the treatment that someone without an intellectual disability would have received, whether it was a colonoscopy, timely manner, or especially dental care. The people were too scared to work with them, or some reason that they may not have told me, but I did hear that people were scared to work with them, or because they weren't sure what the person would do while sitting in the chair.
Yep, uncertainty.
Right.
So what do you think could help clinicians, providers be less scared?
I don't know if it sounds too simple, but just increased exposure, training in school. I mean,
it's that simple. Right? It is that simple.
Yeah.
Unfortunately, it's somewhat of a challenge to implement this important training and valuable training into the healthcare field and healthcare training programs. But it is extremely important. There are millions of people in this country that have intellectual and developmental disabilities, and my thought is that they should have access to a basic level of competent healthcare wherever they go. Just like most of us do when we present to a provider. Most primary care providers understand the basics. Maybe they need a referral on occasion to a particular subspecialist for other issues. But for people with intellectual and developmental disabilities, training is not always there for clinicians, or hasn't been there, and that I think can lead to fear, being uncomfortable. In the same way that I would be uncomfortable if I was asked to do something that I wasn't trained for in my field. If I was asked to, do heart surgery on someone, I'm not trained to do that. So I would be extremely uncomfortable, and the outcome would not be good. So training is really an important aspect of this. So Michael, I'm sure you've had some experiences where a person who had some training, a clinician who had some training, a nurse who had some training, and in this field had a really positive impact on someone's life. Tell us about one of those.
Sure, I'd be happy to. An RN that I worked with was very familiar with this person receiving our services, specifically her services. And there was a new direct support professional who didn't know what to look for in this person's sort of normal, everyday baseline behavior. And she noticed that something was wrong. He was expressing that he was in pain, or that he was feeling more jittery than usual. And it turned out it was actually two things. It was a dental issue, it was pain, and it was an electrolyte imbalance that was causing him to just not feel his normal self. And once she got him to the doctor and they did their assessment, they realized that his diet had changed, and they work towards fixing that.
You mentioned the direct support professional maybe wasn't that familiar with that person, didn't know that person's baseline, and that's one of the things that I like to talk about is how important it is to know a person's baseline. And for people with intellectual and developmental disabilities, that can be very different from one person to the next, and very subtle changes might be the first clue. The change in a person's behavior or their level of activity or level of interest in things. They may just suddenly become less interested in something that they're always interested in.
Right.
That can be a clue to some underlying medical condition.
Right.
And that's one of the reasons, this education and training is so valuable and so important.
And when I taught medication administration in a different state many years ago, I told the trainees, you are the eyes and ears for nurses. You've got to speak up because there may be a little something that maybe you aren't familiar with, or maybe you didn't notice that someone, tell your team, tell the IDT, tell your interdisciplinary team, and someone may figure out, oh, this happened before. I worked with someone who had recurrent small bowel obstructions, and I was new at the provider. And the DSP picked up on it, and we took him quickly to the hospital before he got too dehydrated from vomiting, and they were able to treat him, and he was better within a few days. So that familiarity with the person was a huge factor in him getting the care that he needed.
Being familiar with the person, knowing the early signs of health destabilization, and then acting on those as well. Telling someone, advocating for the person. And sometimes I bet you've had to advocate heavily sometimes because, maybe you're aware that there's a change and you're bringing them to a healthcare provider who's seeing them for the first time, and you're explaining, well, there's this change in his behavior, and the healthcare provider may not recognize the significance of that. So you probably have to do some advocacy work, in a lot of those instances as well.
And you need to push harder than you may normally have to push. Not to say normally, but then one person should have to push.
Yep. I agree with that.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So one of the things that we do here is I do what we call 3 and 3. So I want you to think about 3 things that you'd like to share with everyone related to actions or things that people can do that you think can have a positive impact on just general health, wellness, health equity, really anything like that, to improve health and wellness for people with intellectual and developmental disabilities. And it's 3 and 3 because 3 things in 3 minutes. All right? Shouldn't be hard. All right. Go.
The first thing I would say is listen. Listen to what the person is saying, the person receiving care. Listen to what the DSP, just like we were just talking about, listen what the DSP is noticing. Familiarity. learning about the person. We have a care plan that the RN puts together for the DSP, and the way I explain it is, imagine the DSP is at the first day on their job. The person that they're working with does not communicate through words, and there's no other colleague there. The person needs to know what the person receiving care needs. They're going to read the care plan. And, you're not going to include everything. That could be a 20-page care plan, but include the basics so that they know certain person-centered things that the person needs. So that familiarity with the person reading their care plan. And number 3.
I want to go back to number 1 because I think it's an important point. You talked about listening, and listening really is important and valuable. And sometimes people of different disciplines may choose not to listen to people of other disciplines. There may be a sense of a hierarchy or status or experience. But I cannot tell you the value of listening to people who are familiar with that person, regardless of their clinical background or whatever. As a physician, direct support professionals often were the people that I would interact with that would tell me, something's not right. I don't know what it is, but something's not right. And these are the things that this person is doing, or these are the changes. And as a clinician, I learned how valuable just that little bit of information was. And then I also learned what questions to ask. Because there are things that we see more often in people with intellectual and developmental disabilities in terms of health issues, constipation, seizures, aspiration, all of those, the big things. We call them the fatal 5 plus, right? Yeah. But so a direct support professional who doesn't have medical training may not be able to tell you, well, this and this happened, and I think the person is aspirated. Would you evaluate him for a potential aspiration episode?
Right. No.
But they're going to say, something's going on. We were eating, and he just started acting different, and he's not the same. And can you check him out? And so it's knowing what questions to ask, and okay, this happened when he was eating. Could he have aspirated something like that?
And the people need to be comfortable knowing that they can say whatever they need to say. Either the person receiving the services or the DSP needs to feel comfortable. That's not my third. I thought of another third, but that's, okay. They need to feel comfortable. Like, they need to know that the doctor needs to know this information. The nurse needs to know that NP, they've got to speak up.
And with that, while it's important to listen to the support staff, we also need to listen to the person themselves and speak to the person themselves. And there's a lot of information we can get there, so we never should discount the person as well, too. So it's really listening to everyone.
Right.
Yeah. So what's your third?
Third one is time. Taking time for the RN to write their care plan, to listen to the person receiving services, to listen to the DSP, for the DSP to take time to read that care plan of what they're expected, which interventions are expected for the person for the direct support professional to follow through with, and time to allow the person to speak, because as we've learned, they may take longer to either process what you're asking or to process how they're going to answer your important question and their important answer.
Well, those are 3 great things to think about and to talk about. And I think, you've really done a great job of emphasizing the importance of education in general, and the work that you do, I know touches the lives of people. I know you said you're not directly providing supports and services now, but you're indirectly certainly having a positive effect in this field and in this world.
Thank you.
I really appreciate you taking the time to be with us today and to share this information and share your story. And thank you for the work that you do in this field.
You're welcome. Thank you.